I'm Christy Dye. I'm the Chief Business Development Officer for Contexture, and I'm here with Melissa Kotrys momentarily for our presentation of the 2021 Health Current HIT Leadership and Organizational Awards. Thanks, Melissa.
Wonderful. Well, I'm happy to join everybody again virtually today. Really seems like there's some fantastic sessions going on. I've been watching from the other side of the screen here, so really appreciate all the speakers and all the great topics, including the panel we just heard on community cares. So now we are eager to present the 2021 Health Current Health IT Awards. I've got a script here, so I'm going to be referencing it because we've got a lot of great information to share about this year's awardees. So first, we're going to start with the Health IT Leader Award that recognizes an outstanding individual whose leadership has helped advance healthcare through health information technology and health information exchange. I am pleased to announce that the recipient of this year's Health Current Health IT Leader Award is Dr. Kishlay Anand. Dr. Anand is the founder and president of Apricus Health, an integrated and extensive healthcare system designed by physicians to make healthcare easier. Never forgetting it is people who care for people. A board-certified cardiologist and cardiac electrophysiologist, Dr. Anand encourages his team to focus on providing solutions that help the healthcare industry shift from reactive care to a continuous and interconnected care relationship. Apricus Health services include an aligned primary care provider network, a unique value-based payment model, 24/7, 365 access to care, a robust telehealth platform, care navigation and clinical collaboration, an integrated care management platform with remote patient monitoring, fully integrated population health management, a state-of-the-art technology infrastructure, and real-time intelligence, analytics, and reporting. By leveraging technology to proactively reach patients in the community, Apricus Health has expanded access to healthcare services, improving patient outcomes, and reducing rising costs. They recently opened the Akos Medical Campus, a cutting-edge healthcare facility located in the heart of Avondale's Health Tech Corridor. The facility was purposefully placed in the West Valley to improve access to robust 24/7 by 365 healthcare services for the growing and historically underserved population. They were selected by the Centers for Medicare and Medicaid Services, CMS, to participate as one of only 53 direct contracting entities in the country. And the value-based care model that they have adds benefit enhancements to Medicare patients enrolled in the Apricus Health Network. Giving back to the local community is a top priority of Apricus Health, especially when it comes to the health and well-being of friends, families, and neighbors. So please join me in honoring Dr. Anand as the Health IT Leader of the Year. It is truly well-deserved. And I believe we have someone who's going to accept the award on Dr. Anand's behalf.
Tell us how we can do this, Bill. Is this going to work? All right, perfect.
Okay, so I think we're set to move on to the second award announcement. So now for the Health IT Innovation Award. This honor recognizes an organization for outstanding innovation and achievement in advancing healthcare through health information technology and health information exchange. I am pleased to announce that the recipient of this year's Health IT Innovation Award is Kingman Regional Medical Center. Kingman Regional Medical Center is a 235-bed healthcare organization located across multiple campuses in Kingman, Arizona. They are the largest provider in Northwest Arizona and the only hospital to receive the Governor's Arizona Innovation Award in recognition of their proactive initiatives for enhancing healthcare. They have been an HIE participant since 2015. They've been engaged in bidirectional exchange with Health Current, a differential adjusted payment participant since 2019, and they've served on several health current advisory councils and initiatives over the years. Some of their health IT innovation highlights include that they use interoperable technology for reporting syndromic surveillance and for submitting to public health immunization registries. They implemented Meditech's virtual visit and virtual on-demand care solutions, maintaining strong connections with their patients while providing care from the comfort of their own homes. They've improved patient outreach efforts with registries. These registries have armed staff with information relevant to their patients' diagnoses and have helped identify high-risk populations and patients with chronic and comorbid conditions. Several registries that they've developed include a diabetes registry, a wellness registry, and a behavioral health registry. In the area of diabetes care, they've purchased retinal scanners for on-site exams, and they've increased the number of completed exams from 81% to 94% between May and June 2021. They've got new nurse navigator roles that highlight the important link between patient data and care delivery. Due to this new role, outreach metrics more than doubled between May and June in 2021, with a 20% increase in successful contacts. Out of 220 gaps identified in May of 2021, 50% were closed after follow-up with the nurse navigator. They use a quality reporting dashboard for tracking clinical quality measures to meet MACRA and ARRA targets or ARA targets. Humana's HEDIS and patient safety STAR reports from April through July of this year show a significant increase in Kingman Regional's quality ratings. And finally, they shifted from using disparate reports to creating a centralized business and clinical analytics executive dashboard to serve as a single data model guiding financial, clinical, and organizational decisions. Overall, likely as a combination of all of these strategies and more, their patient experience ratings improved from 76% in April to 82% in July of this year. They are truly innovators. So please join me in congratulating Kingman Regional Medical Center as the 2021 Health IT Innovator.
Oh, I can.
Okay. Let's go ahead and get the obligatory photo out of the way.
Sorry. She's going to realize she made a mistake when she asked me to say a couple words. Again, I'm John McDaniel. I'm actually the interim CIO at Kingman Regional Medical Center. And it really, first of all, it's truly an honor to be recognized by Health Current and unsolicited feedback. And I've been to hundreds over my 50-year career in healthcare. This is one of the better conferences, more important conferences I've ever been to. So I'm coming back. Anyway, on behalf of our organization, specifically our CEO, Will McConnell, and our very dedicated community of heroes that serve our patient population, we appreciate this. Well, we've got a lot of hard work we've accomplished. We've got more to do. And fortunately, with the new leadership team at Kingman, we're making great strides in that. So I appreciate it and really look forward to seeing you again. Thank you.
Congratulations again. Mm-hmm.
Okay, and finally we will present a third award, the Achieve Award. This is an award we started last year in the midst of the pandemic to really honor significant contributions and careers of Arizona HIE community members and stakeholders. Our winner of the Achieve Award this year is Dr. Anita Murcko, Interim Director at the ASU Center for Health Information and Research and Clinical Associate Professor of ASU's College of Healthcare Solutions. Dr. Murcko has nearly 30 years of healthcare experience, including more than 20 years practicing internal medicine throughout the care continuum, teaching in office, hospital, and classroom settings, and more than 15 years in quality improvement and healthcare systems redesign. She joined ASU in 2008 as adjunct faculty, and she also leads Cambiare, the e-health consulting company she founded in 2009. She's previously served as Chief Medical Officer for Health Services Advisory Group, Arizona's Healthcare Quality Improvement Organization, where she led multiple local and national quality improvement collaborative initiatives. She also served as medical director for clinical informatics at Arizona's single Medicaid agency, Access, where she provided leadership for the state's first electronic health record and health information exchange act initiatives. For her formative and innovative work in Arizona's HIE, e-prescribing, and statewide EHR initiatives, Dr. Murcko was recognized by the Arizona Capital Times as Leader of the Year in Public Policy for Healthcare and received the American College of Physicians Laureate Award for lifetime contributions to medicine and healthcare. Dr. Murcko was recently honored by SureScripts for her commitment to better healthcare through technology, and she also volunteers as a board member for several local nonprofit healthcare and performing arts organizations. I've had the personal honor of working with Dr. Murcko kind of before I even moved to Arizona. I don't know if she remembers this, but we first met when she and some other colleagues from Access were at a national conference in Washington, D.C., and I was really excited about moving to Phoenix and had a chance to meet up with them even before I came to Arizona and started working with Arizona Healthy Connection. And really has been an honor working with her over the last close to 14 years this month. And I really acknowledge and recognize all of her dedication to our efforts. She's a tireless advocate for health IT adoption, health information exchange, and putting in solutions that really work for our state. So I am very honored to be providing Dr. Murcko with this award today. So please join me in congratulating Dr. Anita Murcko as the recipient of the 2021 Achieve Award.
Thank you so much.
Sure. Oh, whoops, one more photo. I want to remember this moment here. All right, sure. I would love to say a few words. And yes, Melissa, I do remember that moment of meeting you very, very well. I will share with everyone that we were seeking a new position at Access when I was working at Access at the time. And I went to this meeting in Washington, D.C., and they said, there's this really great woman who you might want to meet, and she might be good for this position. So I said, okay. Well, to make a very long story short, the position at Access became unavailable, but we had this other really great thing that this amazing woman could do. And here we are today. So thank you, Melissa. Thank you, Health Current. Thank you, Contexture, for this incredibly meaningful recognition. This has been a passion for most of my career, being able to care for the total person. The only way you can do that is to have the total information available. So that is what has been driving me all through my career, and informatics allowed me to really get close to that. It was, when we launched the Arizona Medical Information Exchange, or AMI, as we called it affectionately, September 29th, 2009. We never would have dreamed that it would be what Health Current has come to be today. And I do want to recognize Tony Rogers, who was the visionary access director, who wrote the grant for the Medicaid Transformation Grant that allowed us to build the first operational exchange in Arizona. That allowed us to create the infrastructure that became the Arizona Healthy Connection, that became Health Current, that helped us to get where we are today. And I also would like to shout out to a few other key individuals in the beginning. Perry Yastroff, who was our director, our technical project director. Kristen Rosati, who helped us write the first agreements so that we could actually share information with our community partners. I want to recognize also Mike Warden and Dave Kempson. Some of you may recognize those names, the Chief Information Officer for Banner and Maricopa Integrated Health System. Both of those CIOs helped us take the idea to reality. They were our greatest skeptics, and then they became our greatest champions. Finally, I would like to thank the Arizona Medical Information Exchange, the AMI Board of Directors. So led by Bill Vanaski, Dave Dexter from Sonora Quest, and Bill Hagan from United Healthcare. It was this board of directors with this amazing group of leaders that helped us keep health information exchange going in the state of Arizona when the Medicaid transformation grant closed and was not funded. So they financially kept things going. They kept the leadership going until we were able to get our beloved Melissa at the helm, and she created the team that helped us bring us to where we are today on health information exchange in Arizona. So thank you to everyone at Health Current, Contexture, all of those who were part of this wonderful journey. And thank you so much to each of you who continue to support health information exchange in the state of Arizona. Thank you.
Wonderful. Thanks again, Dr. Murcko, and all the other award recipients. As we wrap up our awards presentation for this year, I do want to make sure that everybody knows that for the Health IT Leader and the Health IT Innovation Award, we have an application process, and we really love honoring success stories from throughout the community. And one of the ways that you can get considered for these awards in 2022 and beyond is really by working with us to highlight the good work that you're doing in this area. So you can learn more about the great accomplishments of HIE participants in the success stories section of healthcurrent.org. And if your organization is doing great things with HIE data and services, we really want to hear about it. We are excited to know what works, what doesn't work, how we can improve always. But certainly we'd like to highlight the successes that are happening out in the community. So you can talk to your account manager to learn how to submit a success story. And going forward, when your organization submits a success story, you're automatically nominated for next year's Health IT Award. So please let us know what exciting things you're doing with the services that you receive through Health Current. Submit a success story in the next 12 months, and this could be you standing on stage and receiving an award next year at the 2022 Summit. So thanks again to our team who puts really facilitates the process for getting all these great stories and successes so that we can actually evaluate and honor our leaders, our organizations that are leading in this space each year, year over year. So with that, I'll turn it back over to Christy, and I think we'll be going into the break before some of our next exciting sessions.
That's exactly right, Melissa. So now's time for morning break. Be sure to be back afterwards. We'll start up again at 11:15. We have 2 breakout sessions offered this afternoon or later this morning by 2 of our sponsoring organizations, Equality Health and Ideas Collide. So we'll see you in about 30 minutes.